when should you refer a patient to psychiatrist? So there are some absolute indications when you should always do that, and absolute. And there are some relative indications. The absolute indication means the patient has a serious psychiatric illness and he must be referred to a psychiatrist, such as the patient has a serious or major depression or clinical depression. So major depressive disorder. The patient has a psychotic illness. Maybe he has schizophrenia. Maybe he has bipolar mood disorder. If the patient is acutely suicidal, has a pre-planned, clearly pre-planned suicide attempt. So if the suicide attempt was not meant to be discovered, that is a serious trouble. Refer the patient to the psychiatrist. If the patient has a persistent suicidal intent, that's another risk factor for suicide. If the patient has a persistent suicidal intent. If the patient used violent methods for suicide. So those are all suicide related. Has a suicide attempt, a pre-planned, clearly pre-planned suicide attempt, has persistent suicide thinking, suicidal thought, and has used violent methods. All of those are high risk for suicide. So refer the patient to the psychiatrist. The relative indications are the conditions which are associated with high risk of psychiatric disorder, such as the patient with alcohol abuse or drug abuse, the patient who are older with some serious psychotic disorders, the patient with a family history of suicide in first-degree relatives, those with serious physical illness. Maybe the patient received a diagnosis of cancer. Maybe patient received a diagnosis of any other serious illness. So any serious illness or serious disorder is associated most of the cases with depression. So we have to refer the patient to psychiatrist to have a good assessment and to have specific treatment for depression or any other psychiatric disorders. If the patient is living alone and is not supported, and any patient who gives you a concern of any psychiatric disorder, if the disorder is undiagnosed, refer the patient to psychiatrist for further assessment.